case record cards for our patients are small 5x8 cards. Client then fills out their name and address and the basics of what would be expected to identify the patient and the client. The space down here has got checkoffs for our physical exam that is done by the veterinarian in the back, and that they're acceptable. We tend to put in our standard drugs that are going to be used. And all we have to do then is put numbers in front of them because we know they're basically all the same. The difference is why we would notate them. Otherwise, we try to keep the writing as simple as possible, the date, the service, the amounts, etc. on the card. And the reverse side is the release form with whatever questions that is suitable for your clinic would be put back there. We have a few, and they're all answered by yeses or nos. We have all yes answers expected here and a no down here to make sure that they actually read what they were doing, and then they sign for the service that they've requested. And then this goes back and it's put in a jacket, and this follows back to the surgical team.
Our vaccine clinics Monday through Friday, 8:30 to 1 on a walk-in basis.
Again, our surgery appointment times is drop-off between 7 and 8. And of course, in the big city, why not everybody can get here, but the vast majority of them are, and we're in a position then that it's dribble in. We'll then clean up the latecomers, and then ultimately we pull the sign-in down, and we start our vaccine clinic at 8:30.
And then we have them sign in. We don't use numbers. When we go down the list, after we call the name of the patient.
Once they've signed in for the vaccine, we're in the vaccine clinic mode in the front portion of the clinic. They're invited then to step into the respective booths, and then the girls can be working with the clients from there.
After we handle a patient, we do clean the booths, we sanitize them, and after that, the staff is supposed to go and wash their hands. For the safety and handling of animals, we always keep a leash nearby. Sometimes our clients will come in with their dogs off leash. So for our vaccines, with puppies or kittens, we usually start off a health record so that the owners can keep track of their puppy or their kittens' vaccines, because they need a series of shots, and then they come once a year after that. We have a full line of flea control ranging from Program to Advantage for dogs and cats to Advantix for dogs.
Now what have we here?
Ginger, female cat to be spayed. We're going to get a number for her. The red numbers are for the females, the blue numbers are for the males.
So this is the first one in.
First one, 21.
So we have Phantom Kitty here this morning, Ginger. We look over Ginger, check the sex, check for tapeworms, check for ear mites. If you listen to the heart, look at the mouth, everything's okay.
Then we place number 1 on top of Ginger's head.
Okay.
And we also write number 1 on the carrier. And we also write it on her tag. Number 1.
So now the cat has the number 1 on it. The kennel has the number 1 on it, keeps it identified, and ultimately then the card comes back and the card will get a 1 on it also. So that the card then matches the cat, and that's the way we keep track of 25 cats that are in the hospital at one time. Get put back in, and
Ginger's number 1.
Number one is set in there. Now, I've learned over the years that what works really well is to leave the cats in their own carriers, that the clients bring them in. When the appointment is made, why, it is also mentioned that and the cats in the carriers, dogs on a leash. Okay. If they don't have their own carriers, of course we have kennels for them, but if they stay in their own carriers, they have a place that they're familiar with. The owners usually put in there a towel, nice and warm and cozy, and they just sit up there and wait their turn. And when they get through and they're in recovery, they're sternal, they're moving their head around, they go back into their carrier, and you have kitties that get far less upset being in their carrier rather than be put in a strange place of confinement in a room with other animals with bright light shining around, and that makes a much quieter, peaceful hospital that way.